Thanks everyone for joining. This is a public meeting, so anything shared in the chat verbally or online with the video has potential to be posted publicly. Please be aware.
An additional housekeeping item. So we are doing annual review on auditing members. So if you receive some communication from me, just please be aware of that in the upcoming week. Alrighty, and without further ado, Dr. Woolridge, I believe we're good to go.
Okay, great. Do we have quorum?
I will do roll call. Is that okay? Okay. Alrighty, so Dr. Woolridge, you are present.
Yes.
Christopher Gilbert.
Present.
Joshua Dietler.
I'm here. Sorry.
Thank you. Raymond Perla. Heather Berner. Ann Stafford.
Here.
Yes. Heather Miller.
Present.
Thank you. Jacqueline Evans. Tony Carazino.
Present.
Nikki Kovach. Jordana Carpenter. Here. Okay. And then I believe she has one. I think. Okay, we have sworn Dr. Woolridge. Thank you, everyone.
Great. Thank you. Thank you very much. Well, good afternoon, everybody. Welcome to our Pediatric Advisory Council meeting. And I guess I formally need to call this meeting to order. Going through the agenda, please take a look at the attendance report. That's attachment 3A to the agenda. As a reminder, if you missed more than 2 subsequent meetings, the Bureau will reach to you to determine your ongoing availability and interest in participating. The PACES committee has 2 current vacancies. That's the representative for the Arizona Hospital and Healthcare Association, and the second is as a position as a tribal representative. If you're aware of a viable candidate for either of those positions, someone who would be able to contribute to the PACES committee, please let us know or have them reach out to us for self-nominating. You can reach out to either, well, I guess, would that be to you, Shelley?
Kelly or myself?
Brianna.
Oh, yeah.
Brianna Smith, yeah.
Yeah, or okay. Thank you for that. As far as that's concerned, we do have a 2024 meeting schedule online, so we'll go ahead and check the Bureau website if you want to keep updated on that for our next 2 meetings in this calendar year. That's July and November. This steps us to Bureau reports. We have department updates. Dr. Bradley, are you available for that?
I am, yes, thank you. All right, if you can go ahead and bring up the slide deck from the Bureau, please. I am covering for Chief Garcia, who is out this week, so I will do my best to cover on her behalf. As that's coming up, I'll just skip to the next one, which is our new Bureau staff. So we have several staff members at the Bureau. This includes Karen Barnes, who's our CON auditor, Dave Hansen, who's over our FR Care grant, Mike Hamilton, who's our senior GIS analyst. And then we have Mitch Adair and Jeff McGrath, who are both investigators to our enforcement division. Right. So in terms of our top priorities for 2024, this includes completion of our needs assessment and strategic plan, as well as continuing rulemaking on our EMS workforce development and training. The state trauma registry is undergoing a change due to the vendor sunsetting their current program. We're continuing to promote time-sensitive illness and injuries, including share and a leave behind, as well as a focus on alternative destinations for behavioral health patients. If you go to the next slide, this is our timeline for our EMS and trauma system strategic planning. And so we are currently finalizing, getting all the inputs from the surveys that we have done. So thank you to everyone who participated. I think we had over 1,000 participants that gave feedback to this. In April, we will be holding a summit, which will show coming up. And in September, we will present to SAB and EMS Council a draft plan for approval. And then the goal will be to publish this in November or December with a go live in January for the upcoming 5 years after that. This is to save the date for upcoming in-person and virtual EMS Trauma Strategic Planning Summit. We will be holding that here at ADHS. For those of you that attend in person, we will have food. I am fired and no longer in charge of ordering food, but we will have food, and I promise it will be on time. Next for our EMCT and Trauma Award. So we have extended the nominations for these through the end of March, to March 31st. Next slide. So this will be our second year awarding our EMCT of the Year Award. We did this for the first time at our meeting last May as EMS Council. And I will say this was really one of the kind of most meaningful meetings I've had with the stakeholder and now working with the Bureau. Really nice to be able to take the opportunity to recognize our EMS providers. So if you have not yet nominated someone, you still can. That is open until the end of the month. The Trauma Award is a new award program. So this is something that we are going to be implementing and will be announced at our State Trauma Advisory Board in May as well. We have a number of different nomination categories you can see on the slide here as well. And this will be voted on by the trauma system. We will not be voting in this at the Bureau. For some rulemaking updates, we have completed several rulemakings that you can see up there. We have 2 pending, which include EMCT certification and training, along with EMCT scope of practice. And we have had some work groups and we'll continue to hold work groups looking at critical care paramedics and EMRs, as well as interfacility transfer requirements. If you are not signed up for our Gov Delivery, that is how we share any meeting invite. If you go to the Bureau's main website at the top, there's a link to sign up for our Gov Delivery. Just make sure you select the Bureau of EMS, otherwise you will get all ADHS communication, which you're more than welcome to receive. So it's a lot. For additional state and federal updates, the SHARE program is really excited to have completed the transition of our AED and registry from from the University of Arizona to ADHS. We are also updating other resources on our websites. If you have any questions about the program, please reach out to either Julia Benton or Adam Rodriguez. Our naloxone leaves behind, we are excited to say that we have 2,139 trained CMTs and paramedics in the state of Arizona. We have 29 agencies who are enrolled. We have shipped out 1,336 kits, and we have 99 kits that have actually been tagged, which means these are kits that someone has given out in the community and use the QR code to demonstrate the area where they have given that out. We recognize that there's probably kits that have been given out in the community and someone forgot to scan the QR code and do that. But we are very excited that we know we've got 100 kits out there in the community. If you have any questions, please reach out to Dave Hansen about that. The Department's Office of Injury and Violence Prevention has also released a new news campaign regarding naloxone phase lives. We will share the slide deck after the meeting. This includes a hyperlink to their videos they have produced as well. Some very brief national registry updates. Just a reminder, there's going to be some change in terms of the testing process for national registry that will go into place on July 1st. Our trauma registry system, this is just an important reminder for any trauma program. Our current vendor has ended their program, and so we will no longer be able to utilize that. As a result, we are going to be starting an RFP process with the goal to complete this by July 1st of this year, and the new program will be live July 1st, 2025. We do have our trauma and EMS dashboards here, and we'll, I think, demonstrate some of those later in the meeting as well. I believe that is it. I think we have covered our naloxone leak behind program. I don't know, Brissa, I think I actually covered your section on the trauma database vendor, unless you had anything else you wanted to add. And I think I've covered that. And then Julia, anything you wanted to add to strategic planning, right? Voxel, are you on the line? Don't see her yet. If we can maybe go ahead and just pull up the hyperlink to the dashboard, then I can cover that for her. Oh, actually, we can do this first. Okay, sorry. So this is some of the educational programs that were drafted as part of, I think, very helpful when you look at pediatric patient population. And many patients unfortunately do not have any safety devices on when they're on these off-road vehicles that are involved in crashes. And so this is a program that was put together looking at kind of collecting data. What is some educational material that can be shared out there as well? So a big thank you to Russell and Carissa who have been working on this project. And this is some of our data. So this is our trauma injuries. If you can go up just a little bit, I can see the top tab. So if we go to, as an example of trauma mechanisms. And then if you look under age groups, we can filter, so we can change that to 0 to 17. So that was one of the requests that we wanted to make sure that we have the ability to pull pediatric data. So for any of these dashboards, you can query based on the 0 to 17 age groups, so to capture our pediatric patients. And you can see how some of these rates will change accordingly with that. And with each of these tabs, you can adjust them based on years. So you can see the year on the left, we go back to 2017. And then we give trauma center designation. So if you wanted to see if someone went to a level 1 versus a level 3/4, and see how some of that data changes are reflected to that. And I think if you look at both, and as an example, keeping the pediatric age group here, you can see the total number of incidents, you can see the types of assaults, and then you see some of the age changes. Some of these, if the numbers became too small, the graph does not adjust based on age. So just as an example, not a real example, if you say how many 2-year-olds had a gunshot wound in the state of Arizona, that number is obviously going to be very small. We do not publish data down to that small number. So we have a level where if the data numbers gets too small, we don't want it to be publicly identifiable. So we then kind of hide that data and have it at more aggregate level. So you'll see some of these occasionally, it gets down to very small patient population. You will see that kind of disappear or just be displayed to the statewide level. And I think that is it as a brief summary of the trauma dashboard. Just wanted to make sure this committee knew that was available. We've heard from Southern Arizona actually use some of these dashboards recently for some grant applications. You can pull data about this specific to your region, to your counties, and it's very useful. That's it.
Okay. I will thank you, Dr. Bradley. Does that conclude then the Bureau reports?
Yes, thank you.
Okay, thank you very much. Appreciate that. So that steps us down to our updates on the agenda. First update would be to introduce Chris Gilbert. He is our new member to the PACES Council. He'll be sitting in the pre-hospital coordinator position for the council. I had the honor to meet Chris at the NAMES Pediatric Symposium a couple weeks ago. And Chris, I look forward to working with you. Chris, did you want to do a shout out or make any brief comments?
No, it's a pleasure meeting you. Thanks for having me.
Okay, we'll look forward to working with you and everybody getting to know you. Next update is the neonatal resuscitation program. That training is available. Adam, would you like to make more comment about that?
Sure. Thanks, Dr. Woolridge. The neonatal resuscitation program is still available to paramedics, and it provides free of charge the didactic portion of the neonatal resuscitation program certification. If you wish to complete that certification, you have to do an in-person skills checkoff, and there's a tool at the end of the online portion that allows you to schedule for an instructor in your area, and that may or may not be charged depending on that individual's time and materials used. And there, if you click on the hyperlink in the agenda, it brings you to this enrollment form where I can get your information and we can add you to that course. And I can go ahead and take care of the next update. So we recently, the Bureau's EMSC team recently attended the NAMES Pediatric Symposium, as Dr. Woolridge just mentioned. which is in its 15th year, and it represents a fantastic training opportunity. Thanks, Aubriana, for putting that link in the chat. The name symposium, Pediatric Symposium, represents a fantastic training opportunity. It's a 2-day event that combines lecture and skill stations, which makes for an overall great event, and we want to make sure that we continue to promote the value of that event. So thank you. Otherwise, that's all I have. I'll pass it back to you, Dr. Woolridge or Aubriana, for the assessment.
Yeah, Aubriana is next, referencing attachment 5D. That's the pre-hospital pediatric readiness assessment. Aubriana?
Yes. Thank you, Dr. Woolridge. Can everyone hear me okay?
Yes, we can hear you.
Okay, thank you. Okay, so the first thing I'd like to discuss with you today is the pre-hospital pediatric readiness project assessment. Please keep in mind that the 3 things that I present to you today all correlate to each other. So with this assessment, you may have been familiar with the EMS for Children survey, and this assessment essentially encompasses that survey as well as additional questions to help us as a program gain a better understanding of what EMS agencies need from our EMS team. Next slide, please. Okay, so just to give you a little insight, this is an evidence-based project that they launched at the federal level. So this was established in 2019, and it parallels the National Pediatric Readiness Project that was launched on the emergency department side. And that was created in 2012. And both of these projects aim at improving care for children in emergency services. They're both rooted in quality improvement sciences, and they stem from these joint policy statements to help us to improve pediatric mortality and morbidity rates across the country and the emergency care continuums. Next slide, please. Okay, so just to give you a couple key points of the joint policy that influence the PPRP assessment, there is 7 different components that we took from these joint policy statements for that PPRP assessment, and those are education and competencies for providers, equipment and supplies, patient and medication safety, patient and family-centered care, policies, procedures, and protocols as it relates to pediatrics, and then the interactions with systems of care, as well as QI improvement and performance improvement measures. And although a pediatric leadership wasn't mentioned within these joint policy statements, the evidence has shown that having a pediatric emergency care coordinator within your facility statistically improves the outcomes of that patient as it relates to mortality rates. Next slide, please. Okay, so this is just to reiterate what I just stated. So the presence of a pediatric emergency care coordinator, better known as a tech within our community, it is not, if not one of the strongest drivers of improved quality of emergency care for children. These results that you see here are all aggregated from the 2003, 2013, and 2020 National Pediatric Readiness Assessment that was launched nationwide, and the AZAAP helped to facilitate that within Arizona. Thank you very much, AZAAP. And so this, along with the pediatric improvement measures within the assessment itself, has shown to have a higher level of pediatric readiness in EPs. And then next slide, please. Okay, so this is what our federal partners concluded from all of the evidence and reports from the prior research that they did with the NPRP assessment, and now they are launching this on the pre-hospital side. This is going to be the first of its kind, being launched by all EMS for Children programs throughout the country. And the first step that they want to do to help EMS agencies improve their pediatric readiness is by measuring where they need the improvement. So you have 7 different areas within that, and I will be happy to provide a link to this checklist following the meeting. But there's education and competency. So they're asking, what are you doing for skills checks within your station? There's patients and medication safety. So what policies, procedures do you have for that? Do you have the presence of a tech, which some of our agencies already do, and we thank you greatly from the EMS for Children programs here in Arizona for that. In addition to this, we do have some policies, procedures, and protocols that the federal partners want to check to see if your agency has, as well as what quality improvement processes do you have in place currently as it relates to pediatrics. So next slide, please. Okay, so what does this project entail and when does it launch? So the pre-hospital pediatric readiness project is intended for all EMS and fire rescue agencies that respond to 911 calls and they render medical care within their region. The data collection period will be from May 1st to July 31st. And this assessment, it's going to be, as you can see, a 200 question assessment. However, they do use skip logic, so I don't know if you can see that little question at the bottom, but it does show you if you don't have that specific question to address, then you can just skip a couple further down the line.
Are we able to interrupt for questions?
Oh, yes.
Let's have, you could ask the question.
Thanks. Okay, Allison, do
Great.
your question. Oh yeah, go ahead, Allison. Thank
I was
you.
just gonna say, did you want me to come off mute and state my question that I dropped in the chat, or can you see it?
Yeah, if you just want to reiterate it for the rest of the table that doesn't have the access to the chat, that would be great.
Yeah, so I guess my question was just, and sorry, I apologize really quickly. I am the new manager for the Children and Youth with Special Healthcare Needs program at ADHS, which was formerly Janet Valoria's role. So I'm rejoining PACE after a gap. I had been a part of this group about 2 years ago in a different role at ADHS as the Block Grants program manager. So just wanted to give that context. So my question was just with respect to children and youth with special healthcare needs, and particularly pediatric patients with medical complexity. Is there anything within the checklist or kind of this framework that specifically addresses their unique needs?
At this time, it's garnered towards all pediatric patients. However, something that the EMS for Children program does is it has a family advisor network representative on every or state that's representing EMSD. And so what they do is they focus specifically on children with special or medical needs to address some of these policies within here and help those agencies better understand how we can care for that part of the community.
There's also right down in the checklist, policy procedure and protocol that includes children with special needs.
Adam just also put a link in the chat that can address some of the policies and procedures as it pertains to children with special health care. Thank you, Adam. And Allison for the great question. I appreciate it. All righty. And so, as I mentioned, so this assessment, while it does cover a lot, we've had pilot states that have already tested out this assessment, and they have estimated that it is around 30 to 45 minutes to complete. And it does have that skip logic so that you are able to go to the questions most relevant to your agency. And then what's the benefit to you by taking this assessment? So once you have this information, you'll be able to know exactly where you are. You'll have a path to become more PACE ready, and you'll know what steps to improve your pediatric readiness with a gap report and a national comparison report. You will have immediate access to an overall pediatric readiness summary score. This is from a 0 to 100 scale. And then in the following month, once we do some data cleaning, you will have an agency-specific gap report with link to evidence-based resources to help improve those areas that you were missing those points. Next slide, please. So these are the resources that I was referencing. Our federal partners over at the EMSD Innovation and Improvement Center, they have provided over 200 resources for agencies to review, and it correlates to everything on that checklist as well as everything that's reviewed within the assessment. So if any agencies have questions about, you know, what's a PEC or what equipment could I see on my rig that I don't already have, these resources will be very valuable for that. Next slide, please. And so as mentioned before, this assessment is launching in May of 2024. I could really benefit from using all of everyone that's attending this call, attending in person, any assistance you can have to launch this. This will not only help EMS agencies to improve their pediatric readiness, but this will also help EMSC to understand what we can do to better serve you and the overall community. I will be putting the checklist and a preview of the pre-hospital readiness project itself in the chat that you can pass out to EMS agencies, or you can just, have on hand for anyone that may have questions. In addition to, improving pediatric outcomes, if you can send some people to, or work with people to do some pediatric leadership within the agencies and the emergency department, that would be greatly appreciated. I know we're all here to have the common goal, and we're seeing an uptick with pediatric calls, so any help would be greatly appreciated. And that concludes my presentation for that. Thank you, guys.
Hey, Brianna, thank you so much for walking us through that. Next, we have our discussions and action items. We need to review our minutes and approve those. We did not have quorum in our last meeting, so we have two sets of meeting items to be able to go through. The first would be that to review the November 16th, 2023 meeting minutes, and that is attachment 6A. If you can reference that, maybe we can briefly scroll through that as we go. I'll be calling to the committee to see if anyone has any edits or updates that they want to make towards those meeting minutes.
It's Zeidler. I motion to approve.
Okay, great. Thank you, Dr. Ziegler. Can I have a second in regard to that?
Jordana seconds, Dr. Wilrace.
Okay, great. Thank you so much. So hearing that, let's go ahead and vote to approve those meeting minutes for approval. Let's hear the ayes.
Aye.
Aye.
Anyone in opposition say nay. Hearing none. Anyone in abstention? Okay, the ayes have it, and the November 16th meeting minutes are approved. Next, we have to review our March 16th meeting minutes, and that again is the previous meeting. If we can scroll through those briefly. And does anyone want to edit or update these meeting minutes? Please make that motion. Okay, hearing no edits, can I have a motion and a second to approve these meeting minutes?
Yeah, it's Zeidler. I'll motion again.
Thank you, sir. May I have a second?
Second. Mickey.
Great, thank you, Nikki. Okay, having that motion, let's go ahead and if you vote to approve, say aye.
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 Anyone vote in opposition, say nay. Anyone in abstention? Okay, thank you. The ayes have it, and the March 16th meeting minutes are also approved. Thank you all very much. Next on our agenda is to nominate and vote for positions of a PACES representative on the Education Standing Committee. Now we do have, and maybe Brianna, you can help me here. We have two potential candidates. Just a little bit on the background, our bylaws state that we would send a liaison to the Education Committee, and this individual would be a voting member towards that committee. Therefore, we have to vote to approve that and name that single individual. We currently have two candidates. Brianna, can you walk us through that, please?
Yes. Prior to that, I see Dr. Ziegler's hand up. Is there
Okay.
anything?
Yeah, so Ariana, I believe I am one of those people, and if you have other people that are interested, I am happy to withdraw.
That's very
Nice
kind of
job.
you, Dr. Ziegler.
No problem, which may make this whole next process even easier.
Well, we did prepare a poll to try to vote on 2 individual candidates because there is one other. Um, Go ahead. I'm sorry, Abran. I've interrupted you.
No, it's no worries. I see Chief Pro's hand up. I just wanted to make sure.
Yeah, this is Ray Pro for my fire. Yeah, I'm interested in that position. If doctor doesn't want it, doesn't mind me taking it.
Okay.
So, in addition to that, we also have Christopher Gilbert, who is interested in this. Do we have anyone else that would like to nominate themselves? Okay, Dr. Woolridge, I believe it's between Chief Proa and Mr. Gilbert. So,
Okay.
yeah.
Do we
and I-
have the ability? So the intent here is for the committee to vote to approve one of these 2 individuals, Chris or Raymond Proa, Chris Gilbert or Raymond Proa. Do we have the opportunity to poll to do the selection?
Yes, Julia's going to be pulling that up for us in just a moment.
Okay.
Thank you, Julie. Just please put your name. This is for PACES members only. Yeah, either scan or I just put the link in the chat. If you're in the room, you have the ability to log in on a phone or something like that. So it, members only goes. Yes. Yeah.
Okay.
The website is actually.
My apologies for interrupting. The audio is really quiet from the room for those of us who are online. Would you mind stating that again, the procedure?
Yes, I'm so sorry. For PACES members, the voting link is in the chat, or if you cannot access the chat, then it's just wholeev.com/Julia Vinton 799.
Okay.
I'll put the link in the chat one more time. Please remember to put your name in when you first log in, so we have that at the record. Is there anyone attending that's a member that does not have a smartphone or computer right now? We're all against it.
And just to clarify for everybody, go to your chat, find the poll hyperlink, go to that site. I just did it. It's pretty quick. Put your name in and vote for the one of 2 candidates and hit submit. And this voting for council members. And we'll give it another minute. And if anyone needs more time, please use your mic and let us know. Julia, are you able to identify number of votes? Are we close to a full vote count?
We have received 5 so far, 5 surveys so far.
Okay.
So I think we're waiting for things to be. Okay, so we should 2 left. Wait, okay.
anything else? Okay, so the thing.
Fun, huh? We're gonna change.
Okay, for the best interest of time, Julia, what's our count? Maybe give it one more minute.
I think we have 8 surveys completed, so I think we are.
Right?
Survey.
Okay. All right, so we have concluded the vote. Did everyone feel like they had an adequate amount of time? Yeah, take your silences. Yep, okay. All right, so we have the result. Thank you both for your willingness to serve on the education committee. The vote has gone to Christopher Gilbert for the PACES rep on EDU. Congratulations.
Thank you very much. I appreciate us filling the position, and I think that the liaison with the education committee has been very valuable in the past. Having the treatment and growth of projects that we work in conjunction with the created and been able to contribute to education pediatric focus. So,
Dr. Woolridge, I'm so sorry, but your voice is cutting out. I don't know if it's just on our end. Can everyone online hear him okay?
No, I was extremely garbled. Almost like a lag.
I just wanted to thank the committee. This is a valuable position. We've historically been working well with the education committee for producing pediatric related education content. So this will continue that effort and be doing legal pressure.
Dr. Woolridge, I apologize. It's still coming through with garble or muffles. That's a better word.
I don't see anything wrong on my end. Is that any better if I'm just being analog?
I'm gonna do audio on your.
Yeah.
Oh, no, too. It's not the. No, like another Woolridge, yeah. All right, we can move on.
Can you hear me now?
I can hear you now. I believe it sounded a little clearer, yes.
Okay, I apologize. I don't see anything wrong on my end. So it must be a connection issue. In the university systems, it's a high-speed connection. So I apologize. I'm going to continue. Please let me know if we continue to have audio problems. I'm going to step us down to our next agenda item. And this is where we need to nominate and vote for a position for the PACES vice chair. This is a position where a committee member or a council member can be nominated or be self-nominated to essentially work in conjunction with myself and Andriana of voting organization chairing of the PACES meetings. We have one nominee at this point. That nominee is Jordana Carpenter. But I'd like to open it to the council to hear if anyone else wants to nominate, self-nominate to be considered for vice chair. Would anyone else like to self-nominate?
Dr. Zeidler, I saw your hand come up.
I'm good, thank you.
Okay, no worries. Thank you. Just to reiterate, just in case anyone didn't hear Dr. Woolridge fully, so we are nominating and voting on the vice chair for PACES. At our prior PACES meeting, Jordana Carpenter was self-nominated and was looking for clarification as to what the role would be. I believe if you can give me a nod, Dr. Woolridge, that we are looking for, thank you, for anyone else that would like to nominate themselves for vice chair. And if not, we will go to holding a vote for Jordana.
The responsibilities include taking over chairing the meeting in jail absence.
Yeah.
Not at home. Or party boards.
So during all of the nominees, I would like to have a motion and a second to move towards a vote to nominate Jordana Carpenter as vice chair for PACES. May I have a motion?
I'll motion.
Thank you.
Let me just repeat it so that everybody can hear, but I'll motion for Ms. Carpenter to be vice chair.
Thank you.
Thanks to Dr. Advisors.
Can I have a second, please?
I'll second it.
Tony Carrasino, okay, and Chief Ramos.
Okay, thank you. So motion and second, all of those in favor of Jordana Carpenter, the position of vice chair for the PACES Council.
Start immediately.
Can you guys not hear me?
All right, Dr. Woolridge, coming to
It might be best if you log out, log back in.
I'll do that. Yeah, I'll bring on if you can take over this vote. I'll be right back.
Brianna, do we need to do a poll type of vote, or is this just going to be a yay or nay?
It's just gonna be a yay or nay, as Jordana is the only candidate at this time. Unless anyone else wants to volunteer or nominate.
I concur. Can you hear me better now?
Yes, thank you, Dr. Woolridge.
Okay. My apologies to the committee and anybody else in attendance. So yeah, at this point, I know of no other nominee other than Jordana. So aside from having a second, we would simply do a yay or nay vote. But just because we had audio problems earlier, I wanted to call one more time. Does anyone else on the committee want to self-nominate for the vice chair position? Hearing none, I would like to move us towards a vote to vote whether Jordana will be vice chair of the PACES Council. Can I have a motion to move towards that vote?
I think we have the motion. We're just ready to proceed with collecting the aye vote.
Okay, all right, thank you for that. For those in favor of Jordana being vice chair of the PACES Council, say aye.
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 Anyone in opposition, say nay. Do we have any abstentions? Okay, the ayes have it. Jordana, looking forward to working with you. Congratulations for the vice chair position of PACES. How is my audio now? Is it any better?
Excellent.
We can hear you loud and clear.
Okay, I don't have to yell anymore. Okay, well, again, my apologies to the group regarding that. So next on our discussion is the EMS 2025 initiatives for the Pediatric Emergency Care Coordinator, Resource Collaborative, and Pediatric Recognition Program. Please reference attachment 6E. Abriana or Adam, if you would be willing to explain this item.
Yes, I would be happy to. So what we're doing is we're really opening this up for feedback and any insight you may have to these two programs that EMS for Children is looking to launch ideally in 2025. So Julie, if we could go to the next slide. So just to give you a quick overview of what EMS for Children does for the Arizona community and as well as the nationwide community. So we are the only federally funded program dedicated to ensuring that there's pediatric preparedness for emergency medical services and EDs. Currently, we serve over 5,000 emergency departments as well as 15,000 plus or minus EMS agencies. Within Arizona, we work with 349 EMS and fire rescue agencies, 86 emergency departments, and over 1.5 million children. Next slide, please. So, it's in case it wasn't touched upon more during my last presentation about the PPRP assessment. So we do also focus on the emergency department side. We are thankful to our stakeholders that helped to facilitate that program, and they do a wonderful job. And so now our main focus for this year in 2025 is helping to improve pediatric awareness and preparedness in EMS agencies. Next slide. Okay, so the first program that we're looking to talk about today is the Pediatric Emergency Care Coordinator Resource Collaborative Program. Next slide, please. So as mentioned before, we are looking for having pediatric leadership within the EMS side. We've seen it on the ED side have its correlation to improve pediatric outcomes. And we think that having it within an EMS agency will also have the same benefit. When Dr. Bradley was presenting the trauma dashboards and the data, you can see that there's an influx within pediatric calls, so they are becoming more frequent. However, nationwide, pediatric incidents account for around 10% of all pre-hospital calls. And having this limited frequency of pediatric interactions, it often leaves providers with not having this ingrained in their muscle memory. So what we're trying to do is have a person that serves as a liaison that is focused solely on providing pediatric leadership within their EMS agency. Currently, there's PECs within EMS agencies in Arizona, but primarily in hospitals. And these individuals also have connections within their communities as well as with governmental agencies. Next slide. Okay, so this data is actually from our prior EMS for survey data, for children survey data. And it shows that we do have a lot of people that are interested in being PEC, and some people that have already had a PEC within their agencies. And we're looking to really garner that support for the individuals within that don't have a PEC within their agency at this time. The Pediatric Emergency Care Coordinator, we are targeting this more towards EMTs and paramedics as they're out in the field daily serving our wonderful community. So next slide, please. And the two essential components that we would like to discuss with you today is what the PEC Resource Collaborative Program can offer these EMTs and paramedics. So the EMS, we are exploring how this program can provide those individuals with pediatric CEs throughout the year, whether it be with the assistance of state hospitals or medical directors. All the CEs and the training that would be provided would be through PACES and education committee's approval, as we would be having the training discussed within PACES and then approved through the education committee. In the supplemental month, we would be offering a newsletter to the pediatric emergency care coordinators to share with our agencies. As there's events going on throughout the valley and the statewide that are pediatric focused quite regularly, we would love to have them attend those and have the awareness of those events often. In addition to that, we will be providing pediatric toolkits and resources that are nationwide, and additional opportunities for external CEs with our stakeholders and partners. So I'd love to open the discussion up, or if anyone has questions at this time, I welcome those. If not, we can just proceed to the next slide.
We currently, for Phoenix Children's Hospital, every month host an online CE, a 2-hour block that was started by the previous base hospital coordinator, Chris Ramos. So that's something that we are doing. Through that, it brings in our trauma program. So we usually do an hour of medical, then an hour of trauma. So one of our trauma NPs, whoever's on for the evening, will sit down and they will go through a lecture. So it's something that we are doing. So I feel like we have the ability to bring other pediatric providers online. We have our fellowship program. So the fellows have an EMS month where they are required to teach during that month. So I think that Phoenix Children's could help bring expert pediatric care to be able to teach PCEs.
Thank you so much, Chris. I appreciate that. Thank you.
I think just the only thing I'll say about this CE component of what we're trying to figure out is how to actually get the continuing education hours out. Currently, the Bureau has not been kind of the distributor of continuing education hours. That makes sense. So we, the Education Committee put together quite a bit of training curriculum, and we disseminate that information out there, but we don't necessarily give the actual CEs themselves. Not something historically the Bureau has done. And part of that is we don't really have a learning management system. So that is just the one thing that's what the see the case. We need to potentially partner with another entity or regional council to help give those CEs, even if we kind of help with the coaching and coordination, but just really finding a way to make sure that the continuing education hours are given out. Just that is not something we've done in the past. Not something that I think moving forward, I'd love to find a way that the Bureau could have some grant funding to support a learning management program, just to kind of do that type of work. We don't have that currently. So that is just the one potential barrier, but I think there's lots of entities that they can likely partner with to help provide that.
Right, I'd like to have a conversation about that, like outside of the meeting, just to sort of learn what those needs are.
Okay.
Might be something that from the Guardian side might be able to help with.
Okay.
I don't want to like overpromise. I have an idea, but I don't know if it'll actually work.
Okay. Thank you.
And I can share how we're administering the CE through Bates Hospital and how we obtain survey things on the back end, and then how we use that to send out the CE. It is usually successful. It's like 95% of the time. Every now and then I think out of the last one we had 65 people and 2 people said, hey, I hadn't received my CE yet. But usually it's been a pretty smooth system that we had in place. So we can share that to be viable.
Thank you. Thank you all for your feedback. I really appreciate that. And Dr. Bradley as well. Thank you for your insights. Is there anyone online that has any questions or comments? None? So we'll just move to the next one. Oh, Steve Proa, did you have something to say?
Oh, no. Did I raise my hand? I didn't think I did.
No, I saw the mute come off. I'm sorry.
Oh,
All right, awesome. So this is what we would hope to have the benefits be for the pediatric leadership within the EMS agency. So like we said, we would love to give those PECs the resources to, help their agencies improve their pediatric preparedness, whether that be connecting them with the national resources that are provided through different programs, or eventually if we can find some way to provide CEs by partnering or finding an LMS system. That's our main objective. Second benefit would be the community engagement. So we would have a baseline for pediatric emergency care along the continuum of emergency services. So working with the PECs within the EDs and then working with the PECs on the EMS side, they can have a general understanding of what is expected from both teams. And then in addition to this, they would be a liaison between the EMS for Children program and then their agency as well. Lastly, for quality improvement measures, this is a requirement or a encouragement for PECs to complete the PPRP assessment that I just discussed to save on time and cost-effective measures as well. So that is an additional benefit there as well. Do we have any questions for this slide? Okay, I'm hearing none, so we will move to the next initiative of EMSC. Okay, so our second initiative that we would like to have further discussion about is our EMS Pediatric Readiness Recognition Program. I do have to extend credit to Adam and Jordana Carpenter, as this was completed mainly before my time. And so one of the reasons that we are looking to have this recognition program is it's actually a grant measurable deliverable within the EMS for Children program. And so they found that HRSA has found that a standardized program contributes to an organized system of care and the help with the pediatric readiness within both the ED side and the EMS side. So if we don't mind going to the next slide, please. So this timeline was developed to create a sense of organization and ease for the EMS agency. So we would have a time period from January 1st to the 31st to have a virtual or manual submission. We will be doing mail outs, and we also have an online application that is still in development. And if this gets approved, we will talk further about this in the future. And then following that, we have virtual site visit from February 1st to 28th, and where we will do just a walkthrough to make sure if they have any questions about the application and any equipment spot checks that our national partners provide us with that pediatric equipment list. And then they will be garnered a preliminary approval. Following that, in March, we will have a PACES section to discuss and review all of the applicants during that time period where we will finalize approval. And then we will notify agencies leading up until May and then have them formally recognized during EMS week through media recognition. You can see on the right the requirements that we are having for the EMS recognition programs. So you can see we have a pediatric equipment checklist that I just briefly touched upon. This is checked by national and local experts within the pediatric community. The state EMS survey compliance reporting form that is not tied to the bureau, but rather the CPRP assessment that I just discussed. There's patient and medication safety sheets, policy for safe transport. So a lot of these things are covered currently by the EMS agency. So we're not trying to add more burden, but rather add more benefit by having them recognized for that pediatric readiness. Do we have any questions about that?
It's Zeidler. I have a question. Was this thought about in regards to premier agency as well, as far as making premier agencies participate in this program?
That is a great question, Dr. Zeidler. And if you wouldn't mind, we do have another slide deck to present to discuss that exact topic. Awesome. Any other questions? Okay. Alrighty, so moving to the next slide. Okay, so this is just outlining the benefits that the EMS pediatric recognition program would have for agencies. Like I said, they will have media recognition during EMS weeks. They will begin having the pediatric preparedness ingrained in their muscle memory. So they will have all of the resources and tools through the pediatric leadership, but also the resources that PEC is giving to their agency. And then the added bonus is that the EMS for Children program will come in for quarterly check-ins on the request of the EMS agency to have lunch and learn engagement sessions and educational resources as well at that time. So do we have any questions or feedback as to, is this something that you think EMS agencies would like? Is this beneficial to the community overall? We would really value any insight you guys all have.
I guess a question. So I imagine being an EMS agency that there's going to be some apprehension about doing the gap analysis. As we're trying to present this to partner agencies, there's not something that's going to be punitive from them getting this gap analysis, correct?
Correct. Yeah. So all of the data that's collected and within this assessment is not used for punitive measures, but rather to help you improve. None of the data is shared unless you are requesting for it to be shared, which rarely never happens. That's a great question. Okay. And that next slide, please. Right. So if you have any additional questions or concerns, feedback, just please reach out to myself or Adam or the wonderful Family Advisory Network representative, Jordana, and we will be happy to address any questions, concerns, or comments you may have. Thank you very much.
Okay. Brianna, thank you for taking us through all those details. We next have our standing items to discuss and approve the work groups. Having no active work groups functioning right now, unless Adam or Brianna, you had one specifically you wanted to discuss of a prior work group. Julia,
we missed I think we missed a letter F, Dr. Woolridge. Can we back up to 6F, discuss pediatric recognition program and premier EMS agency to address Dr. Zeidler's question?
Yep. Yeah, I'm sorry. So Adam, you cue us in. Go for it.
I'll hand it off to Aubriana. I think she's ready. Thank you.
I promise this will be the last thing I talk about with you guys all today, but thank you for just giving me the time to discuss all of these initiatives and ideas with you. So this is something that we are also looking for your feedback and discussion on heavily. Any insight you have would be greatly appreciated. So as Dr. Zeidler pointed out, did we consider combining our programs with the Premier EMS Agency program? And in fact, we did. We met with David Harding to, further discuss this, and we decided that it was best to present to you at this time. So next slide, please. Okay, so here are the two programs in their entirety, and what the main objective of each program is to improve patient outcomes within Arizona. With the PEAK program, they focus on, all ages, all groups, whereas ours, we want to fully focus on the EMS pediatric readiness side of things. The benefit of being with Premier Agency or PEAK is established. However, our program will be a pilot and novel program at this time. So next slide, please. Alrighty, so PEAK has 6 TSCs that they go over, time-sensitive emergencies. First being suspected opioid overdose at hospital, cardiac arrest, SCE, elevated myocardial infarction, acute stroke, major trauma, and pediatric resuscitation. So they do have a special subject touching on pediatric. However, with our program, we're looking to go further in depth. So with that PPRP assessment that I touched upon, we're looking at those 7 different points that we wanted to focus on, patient family-centered care. Does the agency have a pet, presence and knowledge of pediatric appropriate equipment, et cetera, et cetera. So as you can see there, that's the major distinction among our programs is pediatric focus compared to the overall population focus. Next slide, please. So when we discussed with leadership the similarities and differences of the program, like I said, the similarity is that we're both aiming to improve patient outcomes, and both programs are voluntary programs. However, the difference is that, we are focused more on pediatrics, and with the reporting and how we do quality improvement measures, the EMS Pediatric Recognition Program, we're going to be relying heavily on that gap analysis reporting with that PPRP assessment. The quality improvement, do we have a question? Nope. Okay. So the quality improvement initiatives that we would be going through is through the toolkit that I provided in that first set of slides. And then the use of data for optimizing care, that's where we're going to use the PPRP assessment again. When that data comes to me from our federal partners, it's in a Tableau data portal. So it's a separate process for accessing that data and seeing how you are improving your readiness within your agency. So it's a little bit different of a process as compared to getting your services and all the knowledge you need about PEAP and what you're doing in your program for that. In addition to this, the application and the recognition process is significantly different. So with the PEAP program, the application is a one-time sign up and they do not need to renew. However, with our program, we are looking for renewals every 2 years. The recognition process, I cannot speak to how PEAP does theirs, but I know for ours, we are going to formally recognize them on EMS Week, as well as presenting them to EMSB channel to disseminate that information at a nationwide standpoint. So with that, does anyone have any feedback, comments, concerns?
And maybe I can just make one point of clarification. For the PEAP program as well, it's a one-time application that is a data standard that does have to be met to maintain PEAP status. So it's not like you get it one time and perpetuate it always there. You do have to meet a certain data standard to keep PEAP status.
Thank you, Dr. Brass.
So that was one of the things EMS Council voted on a few years ago. And then there's going to be a proposal coming up the next EMS Council in May to look at specifically adding cardiac arrest variables as an additional, very specific to those variables.
Thank you. I appreciate that clarification. Any other feedback? question? Okay, so the next one is where I would really love some participation. So, next slide, please. So this is the crossroads that we're at, is how do we proceed with our program compared to if we were to join the Premier EMS Agency program. This would be categorized as P+. And the benefits that this would have is, you know, working with an established program and having more exposure to EMS agencies, as those ones that are already recognized in that field, they may be more incentivized to join our pediatric side of things. However, there is some challenges where it's, you know, say if there's an EMS agency within a city, why would they feel the need to join our pediatric emergency recognition program? In addition, if they were to sign up for the pediatrics and they didn't want to recertify, how would that affect their PEAP status as well? So those have been questions that have been presented to us. That may be some potential challenges and barriers for giving this to the EMS community. On the other side of things, if we were to have our own standalone program, it would not have the benefit of working with an established program. Like I said, this is a pilot launch. And it does have a separate program structure. So it does allow the agency to volunteer and show that they're taking that extra initiative for pediatric preparedness. However, it is 2 applications that the EMS agency will need to fill out. And we will be doing the sole work of working with those EMS agencies for the pediatric recognition program. So do we have any questions or comments? What guide do you think we should go to?
It's either, I'll go. I see the benefits of both. My guess is that most of your agencies that are premier agencies are going to have the resources available to go for the pediatric readiness. Ideally, I would love to see everybody, but I think you may be best to start them off separate and see how it works, and then talk about a combination that in the future.
Thank you, Dr. Ziegler. I appreciate the feedback.
I was thinking, I think of the time commitment when I work with the EMS agencies, how spread thin they are when it comes to education and that. So I think we have the
Sorry, I can't hear you guys in the room.
Oh, I'm sorry. So to go to an agency for this, I would see the barrier of time, or like a small call volume. So the 5 EMS agencies that I work with on a frequent basis, their call volume is very, very small. So it's, where do we find a person that would be like the PAC? I started looking at that, started thinking that, and then with the time and resources, because a lot of these departments are stretched pretty thin. So what do you feel like the time commitment is for that PAC person and for the agency outside of the things they're doing now? I think that's like the pushback I would get if I were to approach those agencies with it. I think that would be what they ask for when I approach them, or if I were to approach them.
Thank you so much, Chris. I appreciate that.
Yeah.
I did have something that I wanted to run by you as well for PECs. You know, instead of having one individual within the agency, what if we opened it up to, you know, having a shift PEC? So if we have one person for one shift, next shift, would that be something that would help to alleviate that time constraint?
That would probably help, because then that will help with overtime, because usually anything outside of their shift, they're now for their education and stuff, they're going into overtime. So by having it shift based, that could probably help avoid that.
I would have had a comment. Okay, so Allison states that, and thank you, Allison, for contributing feedback both for the standalone program, because it feels like this would allow more space for conversation and work around children and youth with special care needs. Thank you very much, Allison, for that feedback. I appreciate it.
I'll just leave. I think it will be a challenge to get agencies to apply for an independent program. I think that's gonna just, at baseline be potentially a challenge. Because you have to do a full application, there's additional things involved. That's just my only concern with the independent program is getting agencies to want to take the time to apply to something completely separate things. And then also really getting the messaging out there. I think people been around for a while, we've got different iterations of it at the stage, but people are aware of the program. So we kind of added as the P plus, it's the way to kind of expand on an existing program, but make it pediatric specific. So that would be my only concern with the independent one is really getting these. I love the whole concept of it. I just would be sad to see it go live and very few agencies actually taking the time to apply. That's my only hesitation and kind of why I suggested looking into the P process for it.
So as part of that, so we've done some research and when I started doing this, putting it together, other states already have this up and running, just like our hospital sites that we have. So they haven't run into, they've got a lot of buy-in from it. They haven't really had pushback. And so they have not combined it with any other agency or group or anything else. So that was why we had thought to do it by itself because of the differences in the pediatrics and the general one of Premier. It's going to be all about getting it out there and recognized as a program of itself.
With the already existing PED program, having to fulfill those requirements, be barriers to any agencies that would want to do the pediatric piece, do you think?
I think percent of them definitely would. There's a lot more requirements based on the kind of grant program for EMSD for the pediatric recognition. I think that's part of it, just the surveys and all these questions in that survey. So, that is one of the challenges is putting something into the structure of what's required for the grant that we have to put forward, and then now getting people to actually implement that. So, because it's the Bureau's program, we can make it what we want it to be. So there's way more flexibility. So that's why, the different iterations that have been in place for that have allowed us to kind of see what's successful and not successful. But there's constraints in place because of funding from EMS grant and this program. So that's where I think the difference lies with it. So, the opportunities for that.
Thank you all for this wonderful feedback. I really appreciate the discussion on this. Anyone else on the online side of things want to contribute anything?
Okay.
All right. Thank you, Dr. Woolridge. I believe that.
Yeah. Okay.
Thank you all.
Ariana, thank you, and apologize earlier for the earlier audio and the disjointing component to my chairing this committee. But Ariana, thank you for going through those reports and summarizing the programs there. Very ambitious, and I appreciated the discussion that was had. The next would be to now step to our standing items, which is our last discussion element. And that's the work groups. We don't have any active work groups unless Adam or Abriana want to bring up a prior work group. Although that being said, we are looking for ongoing projects, obviously pediatric related, whether they be modules or anything educational component that we could step into going forward. If you have any ideas or concepts that you'd like to bring up, please email Abriana. And you can see her email there on the agenda and let her know, and we can start putting them on the agenda for discussion. And that concludes our discussion and action items. Next, we have agenda items to be considered for next meeting. If anyone has any agenda items for next meeting, also email Abriana and let us know so we can start working on setting those up. Lastly, we're going to go to a call to the public. Does anyone have any announcements they would like to make? Any future events or meeting items?
is an event coming up I saw on this. Gilbert Fire is hosting for sensory awareness, family event. I will send it to Aubriana to share. It's for, Gilbert Fire's still on for the special needs community. They're gonna be conducting traffic stops with kids that are neurodiverse. And going through some of the sensory awareness issues there. I think there's other local EMS agencies, Phoenix Children's Hospital will be there helping to get resources out to the public. So this is the first event of its kind. They've opened registration. I think they're near like 1,200 participants so far. So it should be a really fun event. It's getting kids into ambulances to see vital signs and go through things of that nature, to walk through a traffic stop, see a fire truck, and have contact with EMS and first responders in the community to get a little bit to get that exposure before they potentially have to have that at home if they had some sort of medical emergency or something. So I can send that to you.
Yeah, welcome that. Thank you.
Yeah, please do. Sounds like a great event. And Aubriana can help you disseminate that. Aubriana, if you don't mind scrolling down on the agenda, there's a long list of upcoming events. And I won't bore you with reading them all to you, but the agenda will let you hyperlink to each one. You can see there's a lot of pediatric related events that are coming up. So please put those into your calendars so that you can participate. We have our Bureau's website for conference events that you can reach to, and for training programs, please make use of those. Our next meeting will be July 18th of 2024, same time. And without any other comments from the committee or anybody else in attendance, I think we can move towards adjournment.
Great. Thank you, everybody.
Hearing none, we adjourn. Thank you all.